Hello, lovely mama. Welcome back to Bump to Baby Guide, the pacifier. Such a tiny object, such a huge debate. Some people say, absolutely yes, it saved my sanity. Others say, never, it will ruin breastfeeding and mess up their teeth. And here you are, stuck in the middle, not knowing what to do. I've been there. With my first, I was terrified of nipple confusion. With my second, I handed her a pacifier in the hospital and never looked back. Today, we're looking at the facts. No judgment, no guilt. Just information so you can decide what's right for your baby. Let's get into it. Let's start with the good stuff. SIDS prevention. This is big. The American Academy of Pediatrics recommends offering a pacifier at naps and bedtime. Studies show it reduces SIDS risk by up to 90%. Why? Theories include keeps airway open, prevents rolling onto stomach. Baby doesn't sleep as deeply, which may be protective. This is evidence-based, not a myth-soothing superpower. Sucking is a natural reflex. Pacifiers help babies self-soothe. For many, it's the difference between screaming and sleeping. Pain relief during shots, procedures, or even just general discomfort. Sucking releases endorphins. It's a natural pain reliever, helps preemies. Premature babies often use pacifiers to develop sucking reflex before feeding. Gives parents a break. Let's be honest, sometimes you need 5 minutes. A pacifier can buy you that time. Now, the other side. These concerns are real. Breastfeeding concerns. This is the biggest one. Early pacifier use can interfere with breastfeeding if introduced too soon. The risk baby might suck differently on pacifier than breast, leading to latch issues. But research shows that after breastfeeding is established around 3 to 4 weeks, pacifiers don't harm breastfeeding. Dental issues. Prolonged use, especially past age 2 to 3, can affect tooth alignment and bite. The risk increases with using beyond age 2, using for many hours daily, using sugary dips. Never do this. Dependency. Some babies become very attached. Middle of the night pacifier hunts become a sport. You become a pacifier retrieval service. Ear infections. Some studies show higher ear infection rates in babies who use pacifiers past 6 to 12 months. Nipple confusion debated. This is controversial. Some experts say it's real. Some say it's overblown. The safest approach: wait until breastfeeding is solid. This is the most important practical tip. For breastfeeding babies, wait 3 to 4 weeks until breastfeeding is well established. Signs: breastfeeding is established. Good latch. Baby gaining weight. Plenty of wet diapers. No pain for mom. Why wait? You want baby to learn your nipple first. Once they've mastered that, a pacifier is less likely to cause confusion. For formula-fed babies, timing is less critical. You can introduce earlier if you want. The SIDS rule: once you do introduce, offer at naps and bedtime for SIDS protection, but don't force it. If baby spits it out, leave it. Let's dig deeper into this because it causes so much anxiety. The fear: pacifier equals breastfeeding failure. The truth: hundreds of thousands of babies use pacifiers and breastfeed successfully. What the research says, introducing before breastfeeding is established equals potential problems. Introducing after breastfeeding is established equals usually fine. Pacifier use does not cause early weaning when introduced at the right time. What matters more than pacifier use? Good latch from the beginning. Frequent feeding in early weeks, support from lactation consultant if struggling, baby gaining weight well. If breastfeeding is going well, a pacifier is not going to ruin it. Trust your baby and your body. This freaks parents out. Let's look at the facts. Short-term use first 2 years. Minimal to no dental impact. The mouth is still forming, and teeth move back into place after stopping. Long-term use beyond 2 to 3 years can cause open bite, crossbite, changes to palate shape. But these changes are often reversible if pacifier stops by age 3 to 4. Thumb sucking versus pacifier. Dentists often prefer pacifiers because you can take a pacifier away, you can't take a thumb away. Pacifier use is easier to control and stop. The key is not using pacifier forever. Use it when it helps plan to wean by age 2 to 3. Not all pacifiers are the same. What to look for: one-piece construction. Safety first. Two-piece pacifiers can break and become choking hazards. One piece is safer. Ventilation holes. Holes in the shield allow airflow and prevent skin irritation. Orthodontic nipple. Flattened shape that supports proper mouth development. Round bulbs are less ideal. Right size. Age-appropriate sizes exist. Too big equals gagging. Too small equals choking wrist. Material: silicone, firmer, easier to clean, lasts longer. Latex: softer but can cause allergies, wears out faster. Shield size: big enough that baby can't fit whole pacifier in mouth, small enough not to cover nose. Non-negotiable safety rules. Cleaning: newborns, sterilize before first use. First months, wash with hot soapy water daily. After 6 months, regular washing is fine. Always rinse after drops. Inspection: check regularly for cracks, tears, sticky or swollen parts, loose pieces. Replace every 2 months or sooner if damaged. Never dip in sugar, honey, or sweet things. Cavities, botulism, risk. Tie around baby's neck or crib strangulation, risk. Attach with cords or ribbons. Share between babies. Pacifier clips. Use only with supervision. Remove during sleep. Eventually, the pacifier has to go. When to wean: by 6 to 12 months, ear infection risk increases. By age 2, before dental issues develop. By age 3 to 4, definitely stop before permanent teeth. How to wean: the gradual approach 0 to 12 months, limit to sleep times only, reduce daytime use, remove from crib once asleep. The cold turkey approach 12 plus months, pick a date, explain toddlers understand more than you think. Collect all pacifiers, offer comfort in other ways, expect 3 to 5 rough nights, then it gets better. Creative methods: pacifier fairy leaves a gift. Trade for a special toy. Donate to babies who need them. Cut tip slightly reduces sucking satisfaction, but discard after. Here's what I want you to take away from today. There is no right or wrong answer. Some babies never want a pacifier. Some are obsessed. Some parents love them. Some hate them. What matters is your baby fed? Is your baby soothed? Are you surviving? If a pacifier helps your baby sleep and helps you keep your sanity, use it. If you'd rather avoid it, don't. If you use it now and change your mind later, stop. You are the parent. You know your baby best. Trust yourself. Here's what I need you to remember. Pacifiers are a tool, not a moral choice. They have benefits. They have drawbacks, and neither side is wrong. Use the information we talked about today. Think about your baby, your situation, your parenting style, and then decide without guilt if this video helped you feel more confident. Like this video so other confused parents find it. Subscribe to Bump to Baby Guide for balanced parenting content. Comment below, pacifier, yay or nay, for your baby. Until then, lovely mama, whatever you decide about the pacifier, it's the right choice for your baby. See you tomorrow.